Hello and welcome. This is Dr. GERARD CUOMO. I'm here with another implant rescue case. This is probably a first of a few series on this case, but what we're looking at right now is a loose bridge from teeth numbers 18, 19, 20, and 21 respectively. And of course, so it's a separate entity. Let me move that off your tongue if that's all right with you. Yeah, a little debris there. All right, so here's her anterior bridge, which is all alluded to natural teeth. I think it's natural teeth and some implant work that she's had. And of course, here's our implant bridge. So abutments are going to be on both 18, 20, excuse me, 18, 19. There is one under the 20 area, but the dentist made that a ponic and disconnected the implant underneath. And of course, 21. 21 is a Zimmer. 19 and 18 are both Brannemark, and we're expecting to see just a standard abutment under both. If we can get the bridge out, clean everything up, including the internal threads of the implants, we'll be successful in selecting the right parts to put back in and give our patient back her bridge work. So patient's sons and daughters are dentists, and so we're just obliged to help out and get her back to them and the referring dentist. So here we go. First thing I'm going to do is, we know it's a loose entity, so we have to join that to the adjacent, and that's part of my first protocol. Join it to a stable member somewhere. So we're going to do that. We'll do it to the labial. Actually, I'm going to do it to the lingual surfaces. This way there won't be any cosmetic or issues on the labial side. And so we're going to add this yellow etch material, and we'll take a 2x2 gauze for the lingual aspect. We'll put a little saliva ejector. Are you okay? Yeah. Okay. So we're going to use a saliva ejector next. Slide that over here on the right side. Try to make this video about 10 minutes, and then we'll stop and do some things and then come back. So here we are. So first part of any protocol is to make sure that the fixtures are stable and that the bridge is stable. So I'm going to go ahead and etch this surface and this surface. And we'll do our addition here. Yeah, that's fine. We'll use just about any composite. It'll be fine. We're going to use a posterior composite, heliomolar. That's fine. Just enough to stabilize it, prevent it from moving around. And of course, we'll remove that. Once the bridge is ready to come out, we'll remove the bonded resin, and that'll all come out. So I'm etching right now for about, I want to say about a minute or so, just to get this surface. Hopefully it's bondable. You know, it could be all zirconia, and then we might have an issue trying to bond something to it. We'll find ways to bond to that. So hopefully with this metal ceramic, we're looking at feldspathic porcelain, and we'll get a good bond to that. Coming up on a minute now. So we'll pass that back here. We'll just go ahead and just gently rinse that. And we'll go with a new 2x2 gauze. Alright, I'm just going to dry it lightly. We're going to look for a nice frosted appearance. We'll take this out, change it out, put the new one in. Okay, we're not so worried about long term. Alright, air syringe. Okay, and we're going to put the light down. Yep, there's the frosted appearance, so confirmation that we're going to get a good bond. Okay, silane next. So we're adding a surface silane bonding enhancer. That goes on. Let that soak in for about a minute or so. And we're going to add 3M's bonding adhesive to the ceramic. It also has a silane coupler within it. Transfer it back. Here we go. Alright. that should do that. And we're going to dry that with the light air distribution again and get this thinned down. And we'll just go ahead and light cure that. I'm going to light activate that material for approximately 20 seconds on each. Okay. And now we're going to add quite a large amount of this material. I need a good long piece to put in there, so we'll start to do that. How we doing? Okay? Great. Okay. All set to add. Again, this is just temporary fix. We're not going to keep this bonded material unless we had to for whatever reason. Just on there just to kind of hold things together. That's all. And we just dip that in a unfilled resin. And I'm going to take a little more material, and you can transfer that when you're ready. Okay. Alright. And take that gold instrument back. Now, just going to wet my finger a little bit with some of this monomer. I'll push it all the way down, make it smooth. In case she has to close, there won't be any jagged edges anywhere. So we'll do that next. I'm just giving it a good coat, a smooth coat here. Alright, we're getting ready to light cure that now. That looks good. Let's see if I can just hold it down and center it. We're good. Yeah, stabilization first, because you know if things move around while you're working, certainly you're going to end up with some issues. And those little plugs that you see in those access openings, we're going to take those plugs out now. That'll give us perfect access. Now don't forget we had a prior access by a general dentist as well as a periodontist, so we're going to try to go through their footsteps now and try to get things taken care of here. Okay, you want to tip your head down a little bit. Okay, bring it up again a little bit. Right there is good. Alright, we can bring the light up. Clean that for me. Alright, this is the first one. This is going to come out. Why don't we just focus on one at a time? Let's do this one first. Okay, so this is our Zimmer. And we're going to look inside and see, try to identify the screw itself. So first time to do is just clean the inside. Make sure there's no debris in it. Okay, and then we'll microsuction that out. Okay. Looks like we still have some debris in there, so we'll scrub that again. Maybe get a larger brush for me, something like a go-between. Okay. We borrowed these from the perio side or the hygiene side of your practice. Okay, rinse that out. Alright, there's still some more in there. Keep spinning and working it. As we don't want any particles to go in there. Great. We'll need a long explorer from the endodontic side. So I need an endo explorer. Great. Very good. Okay, so let's take a look and see where they gained access. So they went down, evidently they made some kind of a slot, which doesn't appear to look like, that might be the end of that's probably not the screw. So we have to find a cement seam and then follow that, because that could be the end of the abutment, although it looks straight. So we'll need to open up internally, and we'll start to do that. We'll be right back with any new things to show you. All right? See you on the next video.